This question is, I think it was an easier one. What is the probable pathology? Can you tell me what is the probable pathology from this condition?
Sir, carcinoma of stomach.
CS stomach, sir.
Very good. So this was a simple one. Carcinoma of the stomach. What are the investigations that will lead to confirm the diagnosis?
Sir, upper GI scopy with biopsy.
About GI feedback. So this was a very simple one and is a sitter one. Okay. So no doubts in this one. And I think those of you who have not appreciated what is what is important in this is that this is the picture. As you can see, the barium picture shows you that this is a part of the stomach which should be something like this, but the rest of the part of the stomach is okay.
अभी मैं नीचे ही हूँ मैच में इसलिए मैं ऊपर जाता हूँ रूम पे तब ले आता हूँ
Right. So, sir, this is the stomach and the duodenum. I think that made you understand with this picture. So, this is this part of the stomach, particularly the greater curvature is more or less deformed. This is the esophagus. And to parallel it with, you can also see how thickened the stomach wall is. And there is a diffuse increase in the thickness. So, this will be a cancer stomach. The biopsy is an upper GI endoscopy with biopsy. Now, this is the same patient whose biopsy came out to be an adenocarcinoma. The surgeon did a surgery, and what is this gross pathological condition called as? This is an easy one.
Lentis plastic.
Very good. So this is the linitis. Can you tell me? This is an old terminology which pathologists still love using. In our terms, or in the terms of a Borman classification, what is this type of a Borman disease, or what type of classification is this one according to the Borman's classification?
Stage 4.
Stage, so it is not called stage 4, sir. It's called as a Borman type 4. Okay. Now, can you tell me a Borman type 1? What is a Borman type 1? Borman type 1? Borman type 1 is, okay, so let me have it quickly, sir. What is a Borman type 1? Borman type 1 is for polypoid. Now, in which type of cancer stomach do we use this Borman's classification? Early gastric cancer? Early gastric cancer or advanced gastric cancer? Which one do you think is something?
Advanced gastric cancer.
Always. So please remember that we use this. So we use advanced gastric cancer, something called as Borman's. Now, what type of investigation needs to be done to see the Borman? Is it a surgery? Is it an endoscopy? What is your opinion on that? Or how can you comment upon the Borman? Like this one is an operative picture. What is your opinion? How does a Borman classification come into the picture? This is the pathology. So we all know that. Okay. So sir, how is it done? Sir, Borman is an endoscopic classification. Borman can be a CT classification. Borman can be an operative classification. So technically, to start with, it will be an endoscopic classification. Borman 1 is polypoid. Remember that Borman type 2 is a fungating type of growth. Okay, so Borman type 2 is a fungating type of growth. Right. So this is the first one to remember. Right. So Borman type 2 is an fungating type of growth. What is important is that this is the type 2. Now the difference between a polypoid and a fungating is that the fungating looks somewhat like an ulcer. A Borman type 3 is difficult to distinguish from a type 2 in that Borman type 3 is basically an ulcer like that of type 2, but as you can see, this is infiltrating the surrounding part of the stomach. Okay. So this is infiltrating the surrounding part of the stomach, right? And what is Borman type 4? Borman type 4
Diffuse.
is usually a diffuse thickness.
Diffuse.
Right. So the one that you can see in the picture is a classic example of a Borman type 4. Now, what is so special about these ones? Now, there are some things that are very special about these ones. To start with, when you talk about a Borman type 4, or technically this is a diffuse infiltration, better called in Borman as a flat lesion. This group of patients are relatively younger. They have on histology a signet ring cell histology. Their tumor grades are, they're usually poorly differentiated tumor. There is, if you have seen the MSI mutations, then please remember that this is very important to understand that this is, and MSI mutations are less, and usually they will present with a perineural infiltration. So this is a very special requirement about a type 4, and definitely the outcome is the worst. Okay. Now, there is something called as a type 3. What is this particular important type in type 3? Type 3, as I've said, is ulcerated with an infiltration. Now, these ones are more or the less, they are predominantly intestinal type, but their grade of differentiation can be mild, from moderate to poor. Okay. They will frequently definitely have a signet ring cell histology, will be frequent, definitely not as much as type 4, but will be fewer scenes. The type 2 is called as fungating growth. Type 3 is called as ulcerating. This is seen in elder patients. This is again an intestinal type. Okay. Then the next point of contrast is that beyond this one, remember that the signet cells definitely will be much less. This kind of tumors usually show a little amount of necrosis. Okay. Finally, when you talk about the type 1, which is polypoidal, polypoidal again are intestinal type. Okay. They have usually an expansive growth rather than an infiltrative growth. So there is an expansive growth pattern. They are usually HER positive in this. So this is something that you are required to know in the pathology. There is, however, said to be something called as a type 5, which has been a new addition to the list. And people say that the type 5 is something of a Borman which cannot be technically quantified and is not very popular in practice. So people talk about type 5. I do not know, in the world of MCQ, maybe type 5 has come in a big way. But this is all about things that you are required to know in the Borman.